Hello and welcome to today's Facebook Live. I'm Dan Bevels with Floyd Medical Center's Public Relations Department, and we're happy to join you on this Wednesday afternoon as we have for the last several weeks, and we'll continue to do so at least through the month of May to update you on Floyd's response to the COVID-19 pandemic. And we are in a situation, as we've said so many times, that seems to be changing day to day. So we just feel like these updates are very important so that you can stay informed and so that we can provide the information that you need to remain safe, but also understand all the steps that we're taking to ensure your safety here at Floyd. And we're going to welcome back this week after a week off, at least from the Facebook Live, Kurt Stuenkel, Floyd's president and CEO. Kurt, thanks for being back with us.
Yeah, pleasure to be here.
And we missed you last week. Missed that update. Well, why don't we just start just right out of the gate, as we often do, by an update on where we are at Floyd related to the pandemic right now.
Great. Again, thank you, Dan. I appreciate being here. But I know that Dr. Ken Jones did a great job last week. Yeah. And I'm so happy to have him on board as our chief medical officer. Our experience right now is that we have seen a leveling off in the cases, and as patients present to us, we have to run a test on them, and so then every day we have a certain number of patients that we call positive for the PUI, meaning we got a result for, positive for COVID-19, meaning we got the results on them, and then we have patients for whom we're waiting on results, and we call those PUIs. That's just the terminology that's emerged. It just stands for person under investigation, meaning we're waiting for a test result. And we treat them as if they have it, so that, in fact, they might, so we actually need to do all the necessary precautions and dress fully out in personal protective equipment. And our numbers for patients that are positive and in a PUI status have been relatively level to trending down. And so that's good news for our community. But also throughout the state of Georgia, they have shown that, and these models change every day, that April the 28th is supposed to be our peak usage for hospital resources, and that's today. But these models change every day, so that could move backwards or forwards, because yesterday it was supposed to be May 1st, and now today they moved it to April 28th. And so perhaps we have hit a peak in Georgia, but even as those words are coming out of my mouth, I'm aware of what's going on over in Gainesville, Georgia. They're having a surge in Gainesville, Georgia. And they had an event, much like the Life Church in Cartersville, where this occurred in a poultry plant, where people are working, close together in close working conditions. And likewise, a number of the workers in this poultry processing plant are of Hispanic heritage, and they have cultural ties in the way that they live, in multi-generational or maybe multiple members in a household. There's a lot of opportunity for the virus to come into contact with individuals, and they've had a surge in cases in Gainesville, and I heard as of yesterday they had 150 patients. Our number has generally been about 10 to 15, and so they are right now at a level of about 10 times what we have experienced here at Floyd Medical Center. And so I just mentioned that because it's less than 100 miles to our east. Yeah. It could happen here. We hope it doesn't. We hope that all the social distancing that is being practiced in our community continues. As society begins to open up, people go to the beauty shop, they go to bowling alleys, they get out and about, that people will practice social distancing. Wear a mask if you have one. If you don't have one, get one. That protects you and especially protects others from you. And we hope that with those types of things that we can keep our levels down. But we'll be ready if something like what is happening in Gainesville happens here. And in fact, to your original question, to give an update, we finished one of our surge facilities. It's out in front of the hospital. We did it in the lower level of our parking garage, and right now it's equipped to take up to 100 patients. This weekend, the Georgia Emergency Management Association will begin to be putting together the modular intensive care unit. That's going to be 20 beds, and that's as you approach Floyd Medical Center. In our parking lot, you'll see off to the left there are a bunch of round concrete pillars there. That's where this structure is going to sit, and they'll be starting to put that together this weekend, we're told, and we hope it arrives, and that's going to take about a week, and that facility will be ready, and I hope we never have to use them. But if we need to, we've made the plans and we'll be ready.
Yeah, we certainly want to be ready. Kurt, you were interviewed in the Atlanta Journal-Constitution this past weekend, and one of the questions I know you were asked, and one of the questions that's been on a lot of folks' minds, is about the governor's decision to reopen the economy. And I thought that what we've talked about, aside from the article, was a very thoughtful response, and I'd love for you to share that now, just how we understand the delicacy of making a decision like that.
Right. Well, the reporter asked me, this was a phone interview, and she said, Kurt, how did you feel when you were listening to the governor's press release? I said, how did I feel? And she said, yeah, how did you feel? And I paused for a couple of seconds. She actually wrote in her article that I paused for a full 10 seconds. I wasn't timing myself. I don't know how long it actually was, but she asked me how I felt. So I sort of had to cycle back and think about what I was feeling. And how I responded is not actually what she reported. What I said was that I felt the gravity of the decision. And then I explained, I unpacked that. I said, but what I mean by the gravity of the situation is that it was a difficult decision, because on one side of the equation, you've got this virus for which there is no vaccination. All we can do is take care of the symptoms. And it's got a certain percentage of folks that are going to get sick, certain percentage of that are going to need critical care, and then another small percentage of people who die. And we've gone over the 1,000 mark in Georgia now, and we're approaching 60,000 in the United States. And those numbers are going to keep climbing. So you've got that on one side of the equation. And then on the other side of the equation, you've got businesses that have been shut down now going on, 6-8 weeks? Mm-hmm. And businesses that are in peril, people that aren't getting paychecks, people that are drawing on unemployment. We've all seen on the news people that are in food lines, getting food from food banks and churches and other charitably minded people. God bless folks that do that for others. And it's widely known, and economists have quantified that for every 1% increase in unemployment, what goes up are suicides, heart attacks, and other health-related conditions. So on both sides of this equation, the coronavirus has taken its toll. Unemployment is taking its toll too, and it's not just the money, it's taking a toll on people's health. And the governor is in a difficult position trying to balance, what do we do here? And I think he made a reasoned choice. Now, there are those that have said, in fact, the president said we think it was too soon. The governor feels otherwise. He said, I think that we have got the things in place where we can respond, and yes, there may be some hot spots that emerge here and there, and we'll deploy resources to help with that. And I think greatly to the governor's credit and other state leaders, they immediately jumped on the nursing home issues, where one of our most vulnerable segments of society to this coronavirus, being the elderly, who are in close confines together, are susceptible, once the virus gets there, to contracting it. And the National Guard were deployed to go out and sanitize and help nursing homes. I think that the government has really been effective in being responsive.
I think it's fair to say that whether it's yourself and our leaders here at Floyd, or the governor or others in these positions of authority, they're having to make decisions today that they could not have imagined 2 months ago, 3 months ago. And so I think that there's a lot of grace to be given all the way around.
Yeah, for sure. Yeah. For sure. This is an unprecedented situation, with, I don't know what the number is, 25, 30% of the economy shutting down because of shelter in place and stay-at-home orders. Our business has gone down. I mean, as we have had to postpone elective surgeries, and I'll talk about that in a minute because we're opening back up, that's had an effect on our revenue, and our organization is experiencing some big financial losses. While our volumes are down, our expenses are high, and the good news is that Floyd is financially strong, and that we have prepared for this type of thing by saving our money. I mean, I've said to our folks here at Floyd, it's much like Jesus' parable of building your house on a solid foundation, and we've built our organization on a solid rock of foundation of having the proper cash balances and investments, and that's going to enable us to, while we're going to be hurt by all of this as an organization, we're going to emerge from this.
Well, you mentioned surgeries. Let's talk about that for a second, because we are opening up, or at least making more surgeries available than maybe we were a few weeks ago. Can you touch on that, and then along with that, the measures we're taking to make sure that folks are safe when they come to Floyd?
Right. Early on, it must have been 5 or 6 weeks ago, I don't have the dates exactly in my mind, but we stopped doing elective procedures. In fact, we did that a few days in advance of the proclamation in Georgia that hospitals should stop doing that. And not soon after that, it happened all over the nation. And the reason for postponing elective cases was to preserve PPE, masks, gloves, face masks, gowns, for all of the influx of cases that people were predicting. And it was not only PPE, it was to be able to have the critical care staff to deploy to take care of these patients in hospitals. And if anybody that's been watching the news has seen what's been going on in New York City as it pertains to hospitals there having to take care of large volumes of people. And so we were all preparing for that, and a key way to prepare for that is to postpone elective surgeries. Now, elective does not mean unnecessary. It just means it doesn't need to be done right now. It's not an immediate emergency. Something that needs to be done, but it can be done later. It can be scheduled to be done. And so that's what we did, along with other hospitals in the region and in the nation. And that constitutes a pretty high volume of our patients. We do a lot of surgeries here. We do 12 to 13,000 surgeries a year at Floyd Medical Center, both in our outpatient surgery center and here within the hospital as well. And so we stopped doing elective cases. We stopped doing elective imaging. We stopped doing a lot of other elective procedures and idled some of our staff, which we've redeployed in other places. But again, those volumes go down. The revenues, the billings that resulted from those also disappeared. You can't bill for something you don't do. Sure. And so we had to suffer the fact that our revenues have gone down. Now, that probably is going to come back in the back end in the months ahead. And I think we'll recover our revenues, but we're going to have these months of losses. And, like all the hospitals in the United States, but as I said earlier, we have a solid financial foundation, and we're going to be able to weather this. Now, we have started to open the valve back up on elective cases, and they've done the same over at Redmond and other hospitals throughout the nation. And this backlog of cases that many surgeons have been holding, they're beginning to schedule these so we can start to get them done. And there are a lot of patients that need this work. They need their surgery, they need other types of tests and procedures, and we're going to start getting them in here.
Well, with that comes, I guess, some understandable concern from folks who are watching the news every day and maybe feeling that anxiety rise up. But the truth is, we're keeping folks safe just like we have all along. Can you touch on those steps that we're taking?
Yes, for sure. I heard Dr. Jones as I was watching him on Facebook later on. He made the comment that it's safer to be here at Floyd than it is to be in a grocery store, and that's the truth. I mean, all the folks here at Floyd are doing their best to practice social distancing. You'll see most of our staff members walking around with masks. If we are ever going to be within 6 feet of one another, that's when we for sure have to put on our masks. You and I don't have on masks right now because I think we're 6 feet apart.
I think so, yeah.
So we're following earlier. Yeah, we're following the guidelines, and this is a safe place. We have great cleaning procedures. We've been putting all of our positive patients and our PUIs in what are called negative pressure rooms so that air doesn't recirculate. The air gets exhausted to the outside to where it gets dispersed. And so this is really a safe place to be. And one of the unfortunate things that's going on at Floyd and nationwide is that emergency room visits are down, urgent care visits are down. I think a lot of this is because people are nervous and they're saying, well, I don't want to go to the hospital. That's where you can get the coronavirus. We're taking care of the coronavirus patients. We've got safety procedures. We're cleaning, we're disinfecting. We're exhausting the air out at a high level to where it gets dispersed. It's a safe place to be. And what is not safe is if you are experiencing symptoms of a heart attack or a stroke, or you have other kinds of distress. What's not safe is to not go seek care. I heard one surgeon talk about the fact that he saw a patient who was then in our intensive care unit, not a COVID-19 patient, a patient that had another issue that was reluctant to come to the emergency room. And he made the comment, if he had just come to the emergency room within 36 hours, I'd have been able to give him surgery and he'd be home. And now he's worse and he's in the ICU. Yeah. So really, we need to get the word out to people. People need to understand, do not delay seeking care. Hospitals are a safe place to be. Our urgent care centers are a safe place to be. Our doctor's offices are as well. If you have some health issue, go seek care.
Yeah, that's our message. Don't wait. Don't wait at all. One of the things that we have done to provide folks the opportunity to seek care in those maintenance situations, high blood pressure, things like that, is offering virtual visits to our primary care locations. In just a minute, we're going to talk to Dr. George Hotz, who's with our Floyd Primary Care Network, and talk about that procedure. But before we do that, Kurt, before we let you go, one of the things that folks are seeing pop up around Floyd right now are the hero stand-ups that are similar in, in tone to our paper dolls that we put out every year to commemorate Breast Cancer Awareness Month. We've got a lot of heroes around Floyd. I'd love for you to touch on that before you go.
Yeah, I'm happy to. In fact, I could talk about our staff for longer than people want to listen. It's just amazing to see people respond in these last 8 weeks. I mean, we had our first patient on March the 3rd. I mean, it seems like an eternity ago, but then on the other hand, every day is kind of running into every other day. But March the 3rd was our first patient, and our folks mobilized, our folks responded, our folks said, we'll take care of these patients. You know, we'll don and doff. Our critical care nurses said, we'll respond. Our hospitalists have responded. I mean, it has just been a humbling experience to work with all of the staff at Floyd and to see everybody in every area come together. And it's not just the doctors and the nurses, it's also the registration people who register folks. Our registration folks, I walk by them every day, their department, and they're wearing masks and face shields. It's everybody throughout our organizations. It's the people that clean the rooms. And our folks in public relations, our director, Haley Walker, asked me a week ago, she said, hey, I've got an idea that's come out of our department. And she mentioned, why don't we do a play on the October breast awareness paper dolls? And then she showed me the prototype, which was, I don't know what you guys are calling them in the PR department, if you're calling them Little Green Men and Women or Floyd Heroes or Green
just
Heroes,
call Floyd Heroes.
or whatever. I think all those things can apply. And
Heroes Behind the Mask.
Heroes Behind the Mask. So there you go. That's why I don't get chosen to name things. So they're Heroes Behind the Mask. And I said, this is a great idea. Take it and run with it. And our PR department did. And these are popping up throughout all of our various campuses. There are various banners that have gone up. The risers on the steps, they put little messages on the risers, you know, thank you for taking care of our patients today. As our people arrive, and most of our folks here at Floyd park in the parking garage, the 6-level deck that's across from Floyd on Turner McCall. We've got signs and banners there that we've put up. And it's just our way as an organization to recognize the heroes behind the mask. And they do amazing work here, stepping into harm's way every single day to show love and care and concern for our community. And it's a wonderful thing.
It certainly is. Well, Kurt, we thank you as always, both for your leadership and also for taking the time every Wednesday to talk to us about where we are, and look forward to this wrapping up, but also look forward to our continued efforts to respond.
All right.
So, thanks very much.
Thank you, Dan.
Kurt Stuenkel, Floyd's president and CEO, providing an update this week. We are also going to talk to Floyd Primary Care Physician, Dr. George Hotz. One of the things that we've instituted at Floyd during this pandemic are virtual visits, and it provides an opportunity for many of our patients to keep seeing the doctor from the comfort of their own home or from work or wherever they may be. It's a very convenient way to see your physician and make sure that you are staying healthy. So as Kurt steps off, Dr. Hotz is going to step on, and we welcome him now for an opportunity to talk about virtual visits. Dr. Hotz, thanks for joining us.
Thank you for having me.
So you are a few weeks into this process now, and just overall, do you give us a feel for how it's going and how patients are responding and how you like it as a physician?
I think it's generally going pretty well. Anytime you start with a new technology, there's always some hiccups, but generally it's doing quite well. We're doing probably 3/4 of our visit that way, and I think patients are generally responding well to it. They really enjoy not having to come into the clinic when be around other sick folks if they don't need to. For general well checkups, it tends to work pretty well. For folks that have difficulties with travel and mobility, it tends to work really well for them. And so we're working well with it, I think.
So one of the questions that we get from time to time from folks is, what kind of, I guess, conditions or what kind of visits work well for these virtual visits? So what is it, a maintenance type visit, or what in general is well suited for this?
So there's really kind of 3 types of visits that tend to work well. Some of the low acuity, urgent care type visits, like mild respiratory symptoms, sore throats, mild back pain, sprains and strains, some rashes, we can do that way, and those tend to work well. Urinary symptoms as well can do that well. The next thing are for general psychiatric care with things like anxiety, depression, follow-up, those tend to work well. And then for chronic disease management, we're doing a lot of hypertension management and diabetes management, and those are working well as well.
So you mentioned something like a rash. So maybe this is a good time to point out that there's a video element to this. So
Correct.
They're able to see you as you consult
Yes.
with them, and you can see them
Correct.
as well. So they actually can show you what they're talking about.
And we can see a lot of what they're talking about. We get a good sense of, with the COVID stuff, we get a good sense of work of breathing, and that's been nice to help sort of triage people from the video aspect. We can see skin pretty well. We can do general joint mobility pretty well. We can do gait well. We can do mental status exam and cognition well. Those tend to be the things that respond well or that are easy to see on the video.
For somebody that might be a little afraid of the technology, it's a pretty simple process, right?
Yeah, the process we're using now, which is Doxy.me, is quite easy. All we have to do is I either text them a link or email them a link, and then they just allow it on their phone or on the computer, and we're usually up and running within a minute of sending it off.
So if someone is curious about whether or not it might work for them, what's the process? How would they find out?
Generally, we have them call the office, and the front office staff is generally able to triage whether they need to be seen in person or can do a virtual visit. And if the staff has any questions, they'll ask us directly, whether this person needs to be seen directly or if we can do a virtual visit.
So there are still those cases where a patient will need to come in and see you. Could you talk about the procedures that we've taken in our primary care locations to keep folks safe and just to assure them that it's still okay to come in?
Definitely. So we have a screener at each location that will check temperature and that will ask sort of a ongoing that's constantly being updated on COVID symptoms, and if either one is positive, then they will ask us, or we will direct directly to the respiratory symptom clinic. In certain clinics, we all have a different way of doing it, but at our clinic, we will bring people in a different way to separate rooms that are cleaned in a separate manner from general well care. And if those 2 screener questions are normal, then we'll put a mask on them, bring them into the office, and everybody wears a mask, and that's all of the staff, all of the doctors, and all the providers and patients. And with this, we'll keep people spaced out. We're trying to do 6 feet if we can in the front office area, in the lab area. And then we just have enhanced cleaning procedures anytime we have patients that are sick or even well. We're alternating rooms and trying our best to keep well people well.
Yeah. So what would you say about your staff and how they've responded in what is a really difficult situation?
Yeah, I think they've responded extremely well. I've been very, very proud of everybody.
Yeah. Well, thanks so much for joining us today and giving us a little more insight to virtual visits at Floyd. We're glad to have this offering and excited to keep it around even beyond COVID-19. I think this may be a new way of doing things.
I completely agree. I can see some very interesting possibilities with it. So,
okay. Well, thanks, Dr. Hotz. We really appreciate it.
Thanks for having us.
Dr. George Hotz with our Floyd Primary Care Network. If you'd like to see Dr. Hotz, if you are looking for a family physician, you can find more information about him or all of our primary care physicians at floyd.org. Just go to the section there where you can take a look at all the physicians we have in the network, and they'll be happy to take care of you. Floyd.org is also a great location for you to get up-to-date information on COVID-19. We are updating that regularly. All of that information is available at floyd.org/COVID-19, and we encourage you to check that out often. We'll be back next Wednesday for our next Facebook Live session. We're going to continue these at least through the month of May, every Wednesday afternoon at 3 p.m., just to provide you an update on how Floyd continues to respond to this pandemic. Until then, we thank you so much for joining us and ask you to be safe.